Cade Cunningham of the Detroit Pistons has suffered a collapsed lung, a rare and serious injury that has sidelined him indefinitely. Reports confirm he will miss at least the next 2 weeks and will be re-evaluated after that period to determine his recovery progress. This comes as a major blow to the Pistons, as Cunningham has been the engine of their offense and a key reason for their strong season. While the team has depth, replacing his playmaking and leadership will be extremely difficult during his absence. The focus right now is on recovery, as a collapsed lung requires careful monitoring to ensure it fully heals before returning to physical activity. The Pistons and fans will be watching closely, hoping their star guard can return healthy as the season pushes forward. A collapsed lung, medically known as pneumothorax, happens when air leaks into the space between your lung and the chest wall, an area called the pleural space. That air pushes on the lung from the outside, preventing it from fully expanding when you breathe. Instead of inflating like it should, part or all of the lung shrinks or collapses, making it harder for your body to get enough oxygen. This condition can happen suddenly and without warning, especially in tall, thin individuals or smokers, which is called a spontaneous pneumothorax. It can also occur from injury, such as a car accident or a broken rib puncturing the lung, known as a traumatic pneumothorax. In some cases, it develops as a complication of lung diseases like chronic obstructive pulmonary disease or asthma, where weakened lung tissue is more prone to rupture. The symptoms usually come on fast. A person might feel a sudden sharp pain in the chest, often on one side, followed by shortness of breath. Some people describe it as a tight or stabbing sensation that worsens when taking a deep breath. In more severe cases, the heart rate increases, the skin may look slightly blue due to lack of oxygen, and there may be fatigue or dizziness. Doctors diagnose a collapsed lung using imaging tests such as chest X-rays or CT scans. These allow them to see how much of the lung has collapsed and whether air is trapped in the chest cavity. The severity determines the treatment approach. In mild cases, the body can reabsorb the air on its own over time. Doctors may simply monitor the patient, provide oxygen, and recommend rest while the lung slowly reinflates. This process can take anywhere from several days to a couple of weeks depending on the size of the collapse. For more significant cases, a needle or small tube called a chest tube is inserted into the chest to remove the trapped air. This allows the lung to expand again. The tube may stay in place for a few days until the leak stops and the lung remains stable. In recurring or severe situations, surgery may be required to repair the source of the air leak and prevent it from happening again. Recovery time varies based on the cause and severity. A small spontaneous pneumothorax may heal in about 1 to 2 weeks with proper monitoring. Moderate cases that require a chest tube often take 2 to 4 weeks for full recovery. If surgery is involved, recovery can extend to 4 to 8 weeks or longer, especially if underlying lung disease is present. During recovery, patients are usually advised to avoid strenuous activity, heavy lifting, and air travel until the lung has fully healed, because changes in air pressure can worsen the condition. Smoking is strongly discouraged, as it significantly increases the risk of recurrence. Even after recovery, there is a chance of it happening again, especially in people who have had one. That is why follow-up care is important, along with lifestyle adjustments to reduce risk. A collapsed lung can sound frightening, and in severe cases it can be life-threatening. But with prompt treatment and proper care, most people recover fully and return to normal activity.